Hi everyone, welcome back to the third part of the lecture. In this part, we will cover the management of the side effects of antipsychotics, especially in the management of tardive dyskinesia and akathisia. Before we go further, let's talk about the FDA recommendation to the schizophrenic patient whose symptoms have improved with the antipsychotic medication should continue to the same drugs. If the patient experiencing any hyperprolactinemia as a side effect of the antipsychotic medication, we should reduce the dose of the current drugs, or the best way to switch the medication regimen to an antipsychotic with less prolactin effects. Besides that, we also may consider to give the bromocriptine to treat the hyperprolactinemia. Clozapine only be given to the patients with treatment-resistant schizophrenia or if any risk for suicide attempts. Depot or long-acting injectable antipsychotic drugs such as risperidone, haloperidol, aripiprazole can be given to the patient who request or prefer these such of treatments. These drugs also can be given to the patient who has history of poor or uncertain adherence issue. Akathisia is one of the most common antipsychotic side effects that cause extreme restlessness and inability to stay still. It can vary from mild to severe and cause lots of distress. As you can see in this video, this patient is restless, which will cause his feeling inattention and discomfort and urge him to constantly move the legs and part of the body such as arm and trunk, like just someone who restless and they cannot suppress the movement. Another way that it can look as needing to shifting the weight from one foot to another or pace. Antipsychotic drugs cause drop of dopamine level, and it also can cause excessive cholinergic neuron activation in certain areas in the brain, specifically in the nigrostriatal pathway that are involved in the controlling movement. Any of the antipsychotic drugs can do this, but the one that have less weight gain and less sedation can do more. If this happens, you may suggest to the doctor to pursue lowering the dosage of the antipsychotic medication or switching to another antipsychotic medication that has less akathisia as a side effect. You may also adding a benzodiazepine medication or beta-adrenergic blocking agent or beta blocker. As mentioned earlier, any of the antipsychotic can induce akathisia, but the one that have less weight gain and less sedation such as aripiprazole and risperidone can do more. The sedating medications like clozapine, quetiapine and olanzapine do not do it as much as any drugs of the antipsychotic because of this drug has antihistamine properties that offset these problems.
Tardive dyskinesia is a condition that affects the nervous system and results in symptoms such as uncontrollable movements of the tongue, jaw, or lips, writhing, twisting, dancing movements of fingers or toes, rocking, jerking, flexing, or thrusting of trunk or hips. Why this happens exactly is largely unknown, but many believe that it's caused by a disturbance of chemicals in the brain when medications to control psychiatric symptoms are taken. Let's start by talking about how the nervous system works. Your nervous system is made up of billions of neurons. These neurons are activated through stimulation from your environment. Stimulation can be internal, such as blood pressure, or external, such as light or sound. When activated, neurons send an electrical signal down to the nerve endings and release internal chemicals called neurotransmitters. There are many different types of neurotransmitters, and each support critical biological functions such as heart rate, memory, movement, pain, and mood. For example, dopamine is a neurotransmitter that plays a role in motor control, hormone production, and behavior regulation. When neurotransmitters are released, they bind to the corresponding cell receptors and signals are relayed to the body. Depending on genetics and environment, some people have too much, irregular, or not enough neurotransmitters to bind to the receptors, causing irregular signaling. This may explain the symptoms of schizophrenia, bipolar disorder, and depression. Antipsychotic medications are often prescribed for treating mental health conditions such as bipolar disorder, schizophrenia, and in some cases depression. Many of these medications block dopamine receptors from being stimulated by dopamine and are called DRBAs. When DRBAs block dopamine receptors, additional dopamine receptors are made available by the body that are more sensitive to dopamine. When dopamine binds to these hypersensitive dopamine receptors, increased signaling can occur. This can then impact motor areas of the brain, which can cause involuntary repetitive movements called tardive dyskinesia, or TD. Certain treatments which prevent too much dopamine signaling may be required to manage TD symptoms. Tardive dyskinesia is a complicated condition that continues to be studied in order to find ways to improve or prevent symptoms that may occur. We hope this video helps you to understand a popular theory on how medications may impact neurotransmitters, which may lead to symptoms of tardive dyskinesia. Please always consult your healthcare provider on all healthcare decisions.
Another most common side effects are tardive dyskinesia. Let's watch this video first.
It makes it more difficult because I have to
It
talk
makes
to
it
people
more
and be around
difficult because I have to talk to people and be around
all day.
people
So the people
all
I'm
day.
around a lot, I
So
just let them
the people I'm around a
know.
lot, I just
Because
let them
I'm sure people think
know.
I'm just being
'Cause
silly
I'm sure
or
people
making
think
ugly
I'm
faces
just
at
being
them.
silly or making ugly faces
Usually
at
whenever
'em.
I'm talking to people for a long
Usually
time and
whenever
we're
I'm talking
looking
to
at each
people
other,
for a long time and we're
like we
looking
are,
at
they'll be
each
like,
other,
why are you making that
like
ugly
we are,
face?
they'll be like,
Stop
why
that.
are
That's
you
what
making
most
that
people
ugly
say. Stop
face?
making faces.
Stop that. That's what most people say.
But
Stop making
unfortunately, I
faces.
can't stop making faces.
But unfortunately, I can't stop making faces.
As mentioned in Dr. Surya's lecture, the first generation of antipsychotic can cause high risk of tardive dyskinesia as compared to the second generation. It is because the action of first generation of antipsychotic that solely inhibits the dopamine receptors cause formation and increase the numbers of dopamine receptors that cause tardive dyskinesia. Meanwhile, atypical or second generation of antipsychotics has rapid dissociation of D2 antagonism, which lead to the dopamine binding afterwards, and the serotoninergic 5-HT2A antagonism activity by the drugs cause some of the dopamine neurotransmitter can bind to their respective receptor in the nicostriatal pathway. This can minimize the formation of new dopamine receptors that essentially lead to the tardive dyskinesia. APA guidelines suggest to prescribe newly approved FDA class of drug which is reversible inhibitors vesicular monoamine transporter 2, such as deutetrabenazine and valbenazine to the patient who develop tardive dyskinesia. These drugs can also call as dopamine depleters through the VMAT2 receptors. These VMAT2 receptors only localize in the dorsal striatum at the presynaptic neurons. This VMAT2 package monoamine in the cytosol into vesicle for release into the synapse. Drugs that inhibit the VMAT2 or VMAT2 inhibitors decrease the amount of monoamine that is packaged and thereby decreasing the amount of monoamine such as dopamine released into the synaptic cleft. Let's have a breakfast before we continue the next video that cover the case scenario as well as the Malaysian latest clinical practice guideline on management of major depressive disorder and the bipolar disorder.